Right. Let's dive into something pretty fascinating today.
Oh, yeah.
Healthcare in a place that's incredibly unique, the Andaman and Nicobar Islands.
Right.
And we're looking at this through a podcast episode.
Okay.
That really reveals how just the geography of a place can completely reshape the entire healthcare system.
Yeah.
So picture this, over 100 islands.
Wow.
Scattered across the Bay of Bengal.
Yeah.
And many of them uninhabited.
Okay.
That's the setting for today's deep dive, and you might be surprised to learn just how much those islands rely on the mainland for even basic health care.
Well, one of the things that makes this situation so fascinating is that the Indian central government is directly responsible for the health care there.
So what?
And specifically, it's the Ministry of Health and Family Welfare.
Okay.
And they have this Directorate of Health Services, or DHS, that handles all the day-to-day operations.
Interesting.
And it's quite different from how healthcare is run in most of India.
So it's not like your typical state-run healthcare.
Right, exactly.
Okay, so not your typical setup, but what does that actually look like for the people living there?
Right.
I mean, how do you even structure healthcare across so many islands?
Well, they have a tiered system in place.
Okay.
So at the top, you have tertiary care, which is basically the highest level of specialized care, you know?
Okay.
And the biggest player there is GB Pant Hospital in Port Blair.
Got it.
And then they also have the Andaman and Nicobar Islands Institute of Medical Sciences.
Okay.
AINHS.
AINHS, okay.
Which is the only medical college on the islands.
Wow. So only one medical college for all those islands?
Yeah.
It really makes you think about how limited the options are for people who might want to pursue, you know, a medical career right there.
Right.
But what happens when someone needs treatment that goes beyond even what ANDAMS can handle?
Right. So that's where the dependence on the mainland comes in.
Okay.
They actually have a tie-up with Chengalpattu Medical College, which is all the way over in mainland India. So you can imagine having to travel that far just to see a specialist.
Yeah.
It's a huge burden, not just the distance, but the financial burden, the time lost, the emotional toll it takes on patients and their families.
Makes you really appreciate how easy we have it, you know, to access specialized care.
Right. Yeah.
Okay, so we've got tertiary care, but let's break down the rest of the system.
Okay.
What about those levels below tertiary care?
So below that, you have secondary care,
Okay.
which is handled by district hospitals on some of the larger islands.
Got it.
And then there's primary care, which is really the foundation of the system. That's where you see those PHCs, the primary health centers, and the CHCs, the community health centers.
Right.
These are spread across the inhabited islands, and they really serve as the first point of contact for basic medical needs.
So the front lines of healthcare for these islanders.
Exactly.
Okay, so we see there is a system in place, but given the challenges, the geography, it can't be perfect.
Right.
What is the government doing to bridge some of these gaps?
Well, they have a number of initiatives in place.
Okay.
One is strengthening their referral systems to try to streamline transfers to the mainland.
So when you've got those complex cases.
Exactly. And then there's the Ayushman Bharat scheme, which is a national health insurance program.
Right. I've heard about that.
It provides free treatment in select hospitals, so it makes healthcare a lot more accessible.
Okay. That's huge.
Yeah.
So that seems to be making a difference across India.
Right.
But what about reaching some of those really remote communities,
Right.
especially the indigenous populations on some of the islands?
Well, for that, they're using mobile medical units.
Oh, man.
So bringing healthcare directly to those areas.
Okay.
And they also have doctors who are specifically trained in the needs of those tribal groups, taking into account their beliefs and practices.
So they're really trying to leave no one behind.
Yeah.
But how effective can these mobile units really be when you're talking about such a vast and scattered population?
Right. And that's where technology comes in.
Okay.
They've introduced telemedicine using a platform called Isanjivani.
Okay.
And this allows islanders to consult with doctors on the mainland without having to physically travel.
So connecting them remotely.
Exactly. And as part of this national digital health mission, they're also implementing digital health records.
Okay, so telemedicine digital records definitely steps in the right direction for a place like this.
Right.
But let's be realistic. Being so remote, it's got to come with a unique set of challenges.
Absolutely.
What are some of the biggest hurdles that they're facing?
Well, I mean, the geography itself is the most obvious one, right? With so many islands, and some of them incredibly remote transportation and logistics can be a nightmare. Just try to imagine getting emergency care to a remote island during a storm.
Oh, gosh.
It's a race against time, and sometimes the odds are stacked against them.
That's a scary thought.
Yeah.
And what about the medical personnel themselves? I mean, it can't be easy to attract and retain doctors in such a remote location.
You're absolutely right. There's a significant shortage of specialists.
Wow.
And even finding general practitioners who are willing to work there is a struggle.
Right.
It's not the most appealing prospect, for a young doctor looking to build a career.
Yeah.
So I'd often rely on doctors from the mainland who might not be familiar with the specific needs of the islanders.
Oh, right.
Or they might not stay for very long.
So you've got this situation where people desperately need care, but there aren't enough doctors to provide it.
Exactly.
And I'm guessing private healthcare isn't really an option either.
No, not really. The market is very small and operating costs are high, so it's almost impossible for private hospitals to survive there.
So the vast majority of islanders are completely reliant on the government system.
Right.
And that's putting immense pressure on an already strained infrastructure. Sounds like they're caught in a vicious cycle. They need more resources.
Yeah.
But it's so hard to attract those resources because of the remoteness and the limited opportunities.
Yeah, it's a tough situation.
And this dependence on the mainland for specialized care just adds another layer of complexity.
Right. If an islander needs anything beyond basic treatment, they're often looking at a trip to Chennai or Kolkata.
Yeah.
Which is expensive and time-consuming.
Wow. We're talking about people having to leave their jobs, their families, their entire lives behind for weeks, sometimes months, just to get the care they need.
It's a huge burden.
It's heartbreaking. And what about access to essential medicines and equipment?
Oh, yeah. That's another challenge.
I imagine that's got to be really tough.
Even getting basic supplies to these remote communities can be a logistical nightmare.
Wow.
Delays are really common, and sometimes essential medicines are just unavailable.
Oh, my gosh.
And forget about advanced equipment like MRI machines or CT scanners. Those are only available in Port Blair.
It's incredible how much we take for granted.
Yeah.
Right. We just assume if we need health care, it'll be there. But for the people on these islands, it's a completely different reality.
It is.
And we haven't even touched upon the unique challenges of reaching the tribal communities.
Right.
Imagine trying to provide care to a community that might be hours away by boat, speaks a different language, and has its own set of beliefs about health and healing.
Exactly.
It's a whole other layer of complexity.
It requires a deep understanding of their culture and a willingness to build trust.
So we've painted a pretty stark picture here.
Yeah.
But is there any hope for improvement?
Oh, there definitely is.
Okay.
Despite all these challenges, there are some really innovative ideas being explored that could dramatically improve healthcare on these islands.
Well, I'm all ears. Let's explore what the future might hold for healthcare in this unique corner of the world.
Sure, sounds good.
All right. So we talked about the hurdles, but now for the hopeful part.
Right.
What kind of innovations are on the table to improve healthcare in the Andamans?
Well, one promising avenue is public-private partnerships.
Okay, so the government working with private providers?
Yeah, exactly. The government could offer incentives like subsidies or tax breaks to encourage private companies to set up shop on the islands.
Interesting idea. But given the small market size and the financial challenges we discussed, how do you make sure that these private providers aren't just prioritizing profit over, accessibility for everyone?
Right. That's a valid concern. You don't want to end up with a two-tiered system where only the wealthy can afford quality care.
Right.
Any partnership would have to have safeguards in place to ensure that the providers are held accountable for delivering quality, affordable care to all islanders.
So maybe some kind of model where the government sets certain standards and regulations.
Exactly.
While the private providers bring in their expertise and resources.
Well, a collaboration.
Okay, so public-private partnerships are a possibility.
Yeah.
What else is being considered?
Well, technology is a big part of the conversation, and we already touched on telemedicine, but it goes far beyond just beta consultations.
Right.
You could use AI-powered diagnostics to analyze medical images remotely.
Wow.
So a doctor in, say, Delhi could assess a patient's X-ray or scan taken on a remote island.
That's pretty incredible.
Yeah.
But wouldn't there be concerns about data privacy and security?
Absolutely.
Especially when you're talking about sensitive medical information being transmitted across such vast distances.
Right. Data security is paramount. You'd need to have robust cybersecurity measures and ethical guidelines in place to protect that information.
Makes sense.
But the potential benefits are huge. Imagine a specialist in Delhi being able to guide a surgery on a remote island in real time.
Wow, that's next level stuff.
It is.
So telemedicine and AI are definitely game changers. Anything else that could make a difference?
Well, the podcast also mentioned using drones to deliver medicines.
Drones delivering medicine.
Yeah, to those hard-to-reach islands.
Well, that sounds super efficient. Wouldn't there be logistical challenges? Yeah, weather conditions, terrain, making sure the delivery is secure.
Yeah, you're right. It's not a simple solution.
And what about things like storage and refrigeration for sensitive medications?
You bring up some really important points that have to consider all those logistical factors. Different types of drones for different situations, secure delivery systems with tracking and authentication. It would require a significant investment in infrastructure and planning.
It seems like these islands, with all their challenges, could actually be a testing ground for some really cutting-edge healthcare solutions.
Yeah, it's almost like a real-life laboratory for innovation.
Driven by necessity.
Exactly. And from a policy perspective, there's a lot the government could do to accelerate this progress.
Okay.
One idea is to upgrade GB Pant Hospital to a super specialty center.
So make that flagship hospital a hub for advanced care.
Right, exactly. That way, fewer people would have to travel to the mainland for specialized treatment.
Okay, that seems logical, but what about the immediate need to get those really sick patients to that care?
Right. Well, that's where improving transportation comes, and increasing air ambulance and speedboat capacity would allow for faster emergency evacuations.
Got it. So faster transport for those critical cases.
Exactly, which could be life-saving.
Makes sense. What other policy changes could have a big impact?
The podcast also suggested expanding the use of AIUS.
AIUS.
Which stands for Ayurveda Yoga and Naturopathy, Unani Siddha, and Homeopathy.
Okay, so integrating traditional Indian medicine systems. How would AIUS fit into a modern healthcare system, especially in such a remote setting?
Well, AIinHealthcare could play a really interesting role, especially for those tribal communities.
Okay.
These systems are often more accessible and affordable, and they're culturally relevant,
Right.
Could be integrated into the existing healthcare infrastructure, potentially even delivered through those mobile medical units we talked about earlier.
So it's about providing options that really resonate with the local population and their beliefs.
Exactly.
Interesting concept.
Yeah.
But you'd still have to ensure quality and safety standards are met.
Of course, that's essential.
Okay. Anything else on the policy front?
Well, perhaps the most crucial recommendation is investing in long-term training programs to develop a local healthcare workforce.
So training doctors, nurses, other healthcare professionals from the islands themselves.
Exactly. It's about sustainability. Bringing in doctors from the mainland is just a Band-Aid solution.
Okay.
Creating a pipeline of skilled healthcare workers from the islands ensures continuity of care. It builds trust within those communities.
Right.
And it fosters a sense of ownership over the healthcare system.
Sounds like a win-win.
Yeah.
You're providing opportunities for the local population while also addressing the shortage of healthcare professionals.
Right. It's about investing in people.
Yeah.
As much as it's about investing in infrastructure.
It's a holistic approach, recognizing that healthcare is about more than just treating illnesses.
Absolutely. It's about social, cultural, and economic factors. It's about empowering communities to take charge of their own well-being.
So we've gone from a pretty bleak picture to some really hopeful possibilities.
Yeah, I think there's reason for optimism.
It seems like there's a real chance for positive change, even in such a challenging environment.
I think so. It just requires a multi-pronged approach.
Okay.
Combining government initiatives with private sector involvement, technological innovation, and a focus on building a sustainable workforce.
And most importantly, listening to the needs of the islanders and tailoring solutions to their specific context.
Exactly. It's not one size fits all.
But at the end of the day, this is about the people living on those islands.
Right.
What does all of this mean for the average person trying to navigate healthcare in such a remote setting? It really puts things into perspective,
Right.
We've talked about the challenges, the potential solutions, but it all comes down to the people, right?
Yeah.
What does this actually mean for the average persons living in the Andaman and Nicobar Islands? What's their reality?
Well, for many islanders, access to quality healthcare is still a huge obstacle.
Yeah.
Even with all the government's efforts, the reality is that living on these remote islands with limited resources means having to make really tough choices.
Right.
Imagine having to decide between seeking care and the cost and the time it takes to travel to a bigger island or the mainland.
Gosh. Yeah.
That's a decision no one should have to make.
It makes you realize, how much we take for granted just being able to access healthcare without those kinds of barriers.
Absolutely.
It sounds like for the people there, healthcare isn't just about treating illnesses.
Right.
It's about their entire way of life.
Exactly. It affects their livelihoods, their families, their overall well-being.
Mm-hmm.
And that's why finding solutions that actually work for them, that fit their specific needs and context, is so important.
And that's where those glimmers of hope come in, right?
Yeah.
Telemedicine, drones, AI, all those things.
Exactly. They're not just buzzwords, you know.
Right.
They represent real hope for people living on these islands.
They can actually be life-changing.
Absolutely. Think about a specialist in Delhi consulting with a patient on a remote island through video conferencing.
Yeah.
Or drones delivering medicine in a matter of hours to communities that would normally take days to reach. Yeah, technology has this incredible power to bridge those gaps and bring quality healthcare to even the most isolated corners of the world.
It's amazing how innovation is often driven by necessity.
Yeah.
And these islands, with all their unique challenges, they could be at the forefront of a healthcare revolution.
I think so.
You know, showing the world what's possible when we push those boundaries of technology and human ingenuity.
It's a powerful reminder that no matter how big the challenge is, there's always a way forward.
Absolutely.
And it highlights the importance of healthcare as a fundamental right. Regardless of where you live, everyone deserves access to quality care.
So even though their healthcare system faces a tough road ahead, there's a real sense of optimism about the future.
There is, with the right investments, the right policies, and that commitment to innovation. These islands could become a model for the rest of the world.
Absolutely, a model for remote healthcare delivery.
And that's what I really hope you take away from this deep dive, you know. This story of healthcare in the Andaman and Nicobar Islands, it's not just about overcoming obstacles. It's about human ingenuity, finding solutions where they're needed most.
Well said. We'll leave you with one final thought.
Okay.
If these islands, with all their challenges, can become a model for healthcare innovation, what does that say about the possibilities for everyone else?
Right.
What if the solutions they're pioneering transform healthcare delivery in ways we haven't even imagined yet?
Yeah, something to think about.
Definitely something to ponder until next time.